My name is Aaron Levo. I'm the Vice President of Communications and Public Affairs. Welcome to the first HHS Town Hall of 2022 on today, January the 13th. We have a packed agenda for sure, lots of updates, and as well, we'll have time for celebrations at the end. We did have the opportunity to answer several questions via the question line that we have open, the email, and we'll put that up on the screen a little bit later in today's town hall so that those that have questions can get an answer from those that are presenting today as well. So I think that's all the housekeeping I have to kick things off. I'll turn it over to our President and CEO, Rob McIsaac. Rob, over to you.
Yeah, thanks very much, Aaron, and good morning, everybody. And thanks very much, as always, for joining. As we begin, as always, I want to acknowledge that we're privileged to provide care on lands that Indigenous peoples have called home for thousands of years. We recognize and respect the presence and stewardship of all Indigenous peoples as keepers of this land. As we begin this first town hall of 2022, it's impossible not to acknowledge the very challenging situation we find ourselves in. Having said that, I do wish people a happy new year and hope that this year will certainly get a lot better than it started in short order. As all of you know, Omicron is very prevalent in Hamilton and in some respects has become the epicenter for COVID-19 in the province. As a result, December was not the restful holiday season that we all had hoped for. As we and many hospitals in Ontario struggled with severe staffing pressures and a very high demand for care, I just have to acknowledge that so many of you stepped up to support your patients and your colleagues. You stayed longer and later, picked up shifts and extended your care and expertise for the sake of our patients. So I think our staff at HHS continues to answer the call, and I'm so grateful for that. Of course, we're not out of the woods. The latest local modeling suggests that we haven't yet reached the peak of the wave. I do think, though, that there is some light on the horizon, and some of the modeling that I've seen, which of course you have to take with a bit of a grain of salt because all models are wrong. But it is predicting a peak within the next week or so. So let's hope that that's true, and we can get past this really difficult hump that we're currently trying to cope with. As you'll hear from Sharon, our occupancy rates remain high across all of our sites, including at the Children's Hospital, which in fact is seeing an all-time high occupancy rate. Today, there are 64 new COVID-related cases in Ontario's ICUs. The prevalence of Omicron in our community continues to not just produce new cases for our hospital, but also impacts on our staffing. We are working on a variety of measures to try to cope with this very challenging situation. We've ramped down services across the whole of HHS and are considering further ramp down measures to try to free up appropriate resourcing to allow us to cope with what's happening. We are implementing return to work protocols to bring staff back as soon as is possible, having regard to all the circumstances. We're doing our utmost to reintegrate workers who are returning from self-isolation in the normal course of things to make sure that we're maximizing the staffing resources that are available to us. And of course, as always, we're working with our partners across the sub-region and our partners across the region, Ontario West, to implement load balancing measures to make sure that where there is capacity elsewhere in other hospitals, that everybody is carrying a reasonably equal share of the load. We're not in this alone, and so I think the provincial system for whatever shortcomings it may have, is doing its utmost to think and act like a system. I want to assure you we are monitoring the situation very closely day and night, and making adjustments as we go, trying to ensure continuity of care. We've put lots of stopgap measures in place, and we don't do that gladly. In fact, we do it quite reluctantly, including things like postponing non-urgent and emergent services, and asking staff not to take vacation. I can't tell you how difficult some of these decisions have been for our leadership teams, but we really have been left with few options. I hope that we'll be in a position to lift many of these extraordinary measures soon. In the worst case, we have some additional things that we can do, but we're holding off on the most drastic things for as long as we possibly can. In the meantime, we need to do everything we can to continue to support one another. Many of us are spending more time at work than at home these days, and so I think that camaraderie between staff members is so important to help us move forward through these very difficult days and nights. Having said all that, I think we have a very full agenda today. I'm going to turn it over to Sharon Pearson to provide an overview on hospital operations.
Great, thank you, Rob, and good morning, everyone. In terms of our status of our COVID population right now, you can see the numbers on the slide. Total 207 COVID patients today. Some of those related to outbreaks and some primary diagnosis. 23 ICU patients. We have less than 5 on ECMO right now, and we have 11 outbreaks in progress, with one area in heightened awareness right now. So an inordinate number of outbreaks for our organization. The next slide, please. The pressures, we've talked about this at so many town halls in terms of the pressures we're feeling and how that translates into our occupancy. I think it feels like 200%, not 102%, I'm sure, for those on the front lines. You can see the pressures there in the raw numbers as far as the overall 102% occupancy. Always remind folks that hospitals should be more in the range of 90 and on the best days, let alone 102, and at the JH 115 in the general, very close to 100%. Again, our ICU occupancy is very high. Have to keep in mind, these are point in time measures in the day. So when it's 95%, that could be when one patient's leaving a bed and the next patient's arriving. So suffice to say, close to 100% every day. The ED volumes are stable. I would not want that to be interpreted to mean they are low. They are stable in that we haven't seen any significant peaks lately, but certainly our EDs remain incredibly busy. We have seen an increase in our ALC since we came back from Christmas. That's not unusual, at 203 cases. And as I've mentioned on previous town halls, our sector partners in community and long-term care also have pressures that they are trying to manage. So it does hamper our flow to our post-acute destinations. Next slide. Rob did mention the ramping down of our services. That was in response to the directive that was issued from the ministry on January 5th, specific to our surgeries, our procedures, and our ambulatory care. And so we have actioned that in terms of our specific ramp downs in those areas. And if you go to the next slide, talk a little bit more about the specifics. So our adult scheduled care has been ramped down by 30% and our pediatric by 20%. On the respective dates. If necessary, we would have to further ramp down if we find we are unable to manage with that degree of service that we are operating. We have had to temporarily close the OR at West Lincoln, and those clinical cases have been absorbed by the other sites. With the support of Niagara Health, we have redirected on a temporary basis our West Lincoln obstetrical program. So many thanks to our Niagara partners for supporting that. With respect to some of the specifics around diagnostics, our interventional radiology, we are maintaining that service. It's an urgent service that's necessary, and as well as DI, maintaining our activity there. And you can see there's a slight impact to some of the services. As far as the ramp down in ambulatory care, keep in mind we have a very large ambulatory program across HHS with upwards of 187 clinics of varying sizes with approximately 850 FTEs. Just to remind you, a large number of those are in our largest areas like the JCC, which provides urgent services, as well as the Ron Joyce. We have moved to only urgent and emergent outplanning activity. We do encourage virtual care when it does not require HHS staff to proceed. The other comment I'd make around our decision-making and our ramp down, we did use the ethical framework. We did adapt that framework for ambulatory care, and we did follow the principles of the directive around equity, proportionality, minimizing harm to the patients, and reciprocity when we're making these decisions. And the next slide. In terms of cancer care, because it is a specific delivery of care we provide, we work closely with CCO within the provincial offices of Ontario Health. So we are still seeing some deferral of care, as you can see on the slide, for conditions that are not life-threatening, which is a small proportion of our cancer population. And those that we can delay, we are doing that. Some of the screening and the outpatient activity has been paused, and we know the sequelae that will cause post this Omicron crisis that we have in terms of some of the pressures to then increase our activities afterwards, and then some pausing in other activity for benign disease. And I think that is my last slide, and I'll hand it, I think, back to Aaron. Thank you.
Yeah, sure. Thanks very much, Sharon, for the update. Next up on our agenda, we're going to hear from Kirsten Kroll, our VP Quality and Performance and Chief Nursing Executive, talking a bit about our deployment efforts. So Kirsten, over to you. Thanks.
Thank you, Aaron. Hello, everybody. Just to give you a bit of insight into what's going on with deployment right now. And this is where the areas that Sharon has just referred to as far as ramp downs, individuals who are being identified that could be deployed elsewhere in the organization to assist with pretty severe staffing shortages. We do have a set of guiding principles, certainly a legacy from even the prior wave 3 in particular, which was our last major deployment. Certainly aspects around patient safety, staff safety, looking to make sure that we're ready for surge capacity, all come into play, but these principles are certainly challenged in the current environment that we're in, given the widespread nature of the shortages that we're seeing. So we are working from priority lists that the VPs are helping to establish with us as far as where we need to try and put the greatest efforts to make some improvements happen. The situation right now is quite different because the wards are vastly impacted with the absences of staff and physicians because of the virus impact on themselves. So it's a very different scenario than what we had in the prior wave, where we were really deploying very much to a critical care and knowing full well that that volume of patients would be arriving then. Of course, Omicron is a different variant, creating a different picture for us. So the ICU needs at this point are just gradually growing. And of course, we're keeping close tabs on how this picture continuously changes. However, the principles that we're also working with, and again, feedback from the last wave was really trying to avoid moving people around more than once. It may happen, we're trying to avoid it. We're also trying where we can to respect schedules. We heard from the last wave, moving from 4 or 5 schedules to other schedules that impacted people's lives. So we are trying wherever we can to minimize this disruption. But of course, it's a very different circumstance and the needs of the units are quite different. So bear with us, and many of you have been doing that. We thank you for that. The bed occupancies that Sharon has referred to as important in this equation as well, not only just the occupancy, but even some of the transition of beds in other parts of the organization that have migrated to acute care. So again, some of those people that may have been part of deployment in past are being utilized in a different way to make sure that acute care beds are available. And of course, the COVID outbreaks also have had impacts on what's going on with our staffing shortages. So all of these things are certainly painting a very different picture for us. What happens when we get our lists of individuals who are part of the deployment, we certainly work with the managers. I mean, Carissa Cordon, Nate Vanadul, and folks with them as far as other chiefs of interprofessional practice and folks in the central scheduling office are trying to do yeoman's work to try and match people to the areas that best people could transition to. Skills assessment have been part of that process. And also, again, referring to our priority list, but also obviously looking at what kind of roles are coming into the lists. So that matching process does happen. Also in conversation with the managers to understand individuals who may have restrictions that impact some of the decision making as well. So just so you're aware, a lot of information we are trying to use as we match people to areas where they are deployed. Next slide. To date, we have just over 200 individuals who have been identified and have been deployed working on areas. The vast majority are in our clinical areas, different wards right across HHS. Every site's had some deployment. Employee health certainly has had some increases as well, trying to keep up with the hundreds of people who are absent and needing to be followed up on. Central scheduling office, you can imagine the workload on those folks trying to keep up with this. And then a bit of support to our infection prevention and control team. So again, we've tried to address a number of needs. Another example also would be general internal medicine. So our medical folks, our physician groups that are out there, we're also keeping tabs on what's happening with them and how we can also support where they run into difficulties. There are very clear processes that we have now, again, building up over the last 2 years, but also trying to make sure that we've got some good communication processes in place, both with managers, in how they're identifying people, but also back to them, and also how we transition people to the new work. You know, in all of this, also attention to try and make sure our educators, who again are stepping up big time to try and help people to transition to new environments, understanding where the skills are, where the gaps might be filled, are there ways to carve out the work a little bit differently. So it's a lot of ongoing work to try and make this as successful as possible. There continues to be regulation in the province. You might recall from wave 3, it allows for regulated health professionals to function outside of their regular scope of practice. Again, people have to gauge whether or not they've got the right competencies to do the work. And of course, we can help to develop those. But it means that people have some freedoms to be reassigned, to not have to worry about ramifications through their colleges because they have perhaps done practices that are outside of the regulation that they are typically working within. This regulation gets updated every 2 weeks, and it has been for 4 months. So we are certainly continuing to rely on that, and people should be rest assured that they are safe to continue where they are feeling that they have that competency. I will just say that, you know, all of this work takes many, many people, central scheduling office, you know, human resources, labor folks, planning and analysis, helping us to look at data, employee health, infection control, the NRT, clinical practice education, you know, even psychospiritual care and the resilience work that will be touched on in a moment, the chiefs and the sites, of course, and the site command centers that are going on. It's a lot of moving parts to try and continue to keep this as effective as possible, and this work will certainly carry on. So I'm going to turn it back over to you, Erin, but much gratitude from all of us for the things that people are doing. Thank you.
Yeah, absolutely. Thanks very much for that update, Kirsten. Next on our agenda on the topic of resilience and our crisis supports in Wave 4 is Dr. Andrea Frolick, who is our Director of the Program for Ethics and Care Ecologies, or PEACE. So Andrea, over to you.
Thanks so much, Erin. Thanks to everyone who's been here today. And I'm going to talk a little bit about the resources that we've mustered to support you and support your teams through what I no longer think of as a wave, but I think of it as a bit of a riptide of Omicron. So just a reminder that all of you are already resilient. Resilience is not a problem for healthcare workers. You wouldn't have made it through your training. You wouldn't have made it this far in the pandemic if you didn't already have intrinsic resilience. But we're all human and we all have limitations. So if you're beginning to feel defeated, depleted, exhausted, hopeless, just know that that's a very human experience. We all reach our limits, and What I'm talking to you about today is the resources available to you when you feel overwhelmed or you feel you just need a little bit of a pick-me-up and additional support. So we now have both resilience and crisis supports available to leaders and teams and staff 7 days a week. We have folk who are on site to provide what we're calling psychological first aid, folk who are psychological first responders, as well as virtual supports available for leaders, individuals, and clinical teams. And a big thanks to our partners in OD, organizational development, and the Peace Program and Health, Safety, Wellness for putting these resources together. So in terms of our on-site support, you can call for yourself, for a staff member, for a colleague, to get some support in addressing any psychological or an emotional distress. You might have just gone through a difficult code. There might have been an error that was made that feels distressing, and you need some support to kind of process that and debrief. There might be stuff happening at home. There is for all of us. And that might be interfering or making it difficult to be fully present at work. So just know we do have on-site resources available to provide a safe space for you to strategize, debrief, self-regulate, talk, and make a plan about how to move forward. Next slide. So these on-site supports are provided by our psychospiritual practitioners. They're here 8:30 to 4:30 at all of our acute sites. They're also available on call for West Lincoln Memorial Hospital. You can reach them through paging. They'll answer within minutes. And they will come and assess and provide support and help you make a plan or appropriate referrals as needed. You can call for yourself, and you can call with a friend if your friend needs help as well. On the weekends and after hours, you can also make a referral through resilience@hhsc.ca. We are responding to emails every day, 7 days a week, including on the weekends. And that email will be responded to, maybe not immediately, but certainly within a day, to make a plan for how to support you, your colleagues, and your team. There are also virtual supports available specifically for leaders and staff. The Resilience Integration Team and the OD department are coming together to provide support to frontline leaders, really any leaders, formal or informal, who are experiencing stress and who need a bit of extra support both for themselves and for their teams. This is a place to be heard, validated, to help you work through problem solving, to help you to figure out what is the right next step, both for you and for your team who you might be leading and who you know might be stressed and needing a bit of additional support. So again, this resource is available by referral through resilience@hhsc.ca, 8 to 4, 7 days a week. And the next slide really talks about the scheduled huddles. In addition to those on-demand resources that you can activate through that resilience email, there's scheduled support 7 days a week for frontline staff who want to just have a place to touch in, talk, debrief, gather some resources to shore up their resilience. And those are available through our daily staff support huddles on Zoom. And then twice a week, we also have specific leader support huddles, also facilitated by our resilience integration specialists in OD, because we recognize that there are different but intense demands on both staff and leaders during this time. And we want to be here to hold you so you don't feel alone in navigating those challenges on your own. So the next slide is just a reminder to all of us to do our PRM practice, to pause and reset and nourish throughout our days. I shared a story about how I'm doing this for myself with the 7 West team that I had a huddle with today. You know, before COVID, I used to feel like my own resilience was like a big bright flame. And right now I feel so depleted that I feel like I'm just carrying inside me this little candle. And this little candle is my, spirit, my intrinsic resilience. And the candle isn't very bright right now because it's pretty dim and it's been pretty stressed. And there's a lot of things that are conspiring to blow it out. But what I'm finding, if I just stay in touch with this kind of determination to do the best I can with what I have, with the values that are important to me, I find I can light just that one little step in front of me. And I take that step, and then that candle can light the right next step in front of me, and I take that step. And what's amazing is that just doing the right next thing through care, through values-based decision-making, by reaching out in collaboration, generosity, and kindness to the people around me and receiving that kindness from the people around me, I'm somehow able to get through one day after another. So maybe that metaphor speaks to you, but I really encourage all of us to do what we can to keep our own candles lit and to trust that anywhere where we can shine even a little bit of light makes the world a little bit brighter. And if you look around and see a friend or colleague whose candle looks pretty dim, maybe just take a moment to check in with them, see how they are, communicate to them how important they are to you, offer them some resources and support, and help us all to remember that this too shall pass. This wave will pass, we'll get out of this riptide, and we'll be on the other side together. So thanks for all that you're all doing, and take care and be well.
Thanks very much, Andrea. And just to note that the resources Andrea spoke of in her presentation are also available on the Hub. So please take time to access those if needed. So next on our agenda is Dr. Dominic Mertz, who's our Medical Director of Infection Prevention and Control, to give us an update, a bird's eye view, if you will, as to where we're at in this wave of the pandemic and what we can expect. So Dominic, over to you.
Yeah, thanks, Aaron. I was asked to keep this shorter today, which is easy to do because there's so many unknowns, and I didn't want to spend too much time on the unknowns. Here's the first unknown: how many cases per 100,000 per week we actually have. You can see that across Canada, every single province and territory has very high case numbers. I would advise people not to compare those case numbers. There's different bottlenecks, different criteria in terms of testing. So case numbers are at this point quite meaningless. Next slide. This is just the provincial case numbers again. Take it with a grain of salt. It looked like we would have peaked based on this, but we also changed the testing criteria. And I think it's fair to say that the majority of people out there with COVID don't get tested, wouldn't appear on this graph anyway. So at best, it's a very rough estimate, and it's only a relatively small subset of people who actually still have access to testing and get a positive test. Next slide. Hospital admissions, a little bit more reliable because we test everyone who comes in, and we have a better feel of why they are here. And when you're looking at this, and this is the weekly average, of in the province above 3,000 at this point of time, but this is the average so far for this week. But you see we are much higher than in any of the waves prior. Now, as you are aware, next slide, the province started to look at due versus with COVID, and I think everyone working in healthcare is well aware that this is not black or white. It's again sort of a best estimate possible in a system where there's a lot of gray zone people who probably aren't here because of shortness of breath due to COVID, but may have other underlying diseases, and then this was just like a little bit on top of that. Or you have a patient with a myocardial infarction who's also COVID positive and presents with shortness of breath. So certainly not black or white. Based on the provincial data, roughly 55% of those patients currently in the hospital, in a hospital setting across the province, is considered to be due to COVID. So COVID being the primary diagnosis and typically admission diagnosis. Next slide. I think the most exact at this point is probably ICU admissions, or people admitted in the ICU and COVID positive, because here I think it's fair to say that the vast majority of those who require ICU care clearly suffer from their COVID infection at this very point of time. Again, the same approach is being used there. Next slide. And based on the provincial data, roughly 85% of those patients currently admitted to to the NICU are COVID positive. I think today it was like 82%, but in that range. So we certainly see those incidental positives in an ICU setting as well. But I think it's fair to say that the majority of those patients who are COVID positive and are in the ICU are there because of COVID. And this is probably the best metric we currently have to get an idea of what's happening within the province, out in the community as well, which translates to hospitals eventually. Next slide. Models, I again keep this short because the last provincial models shared by the Ontario Science Table are more than 1 month old and showed that large uncertainty, as you can see, with those large ranges in that red zone, which would have been no additional measures, versus if we were to use a circuit breaker on December 15th, which, as everyone knows, did not happen. And today's case numbers are 9,000, but as I said previously, take those numbers with a grain of salt or even just disregard them at this point of time. It's not really helpful anymore. Next slide. This is not case numbers, this is ICU occupancy, so wrong title. But regardless, again, here the estimates of what we would see in the ICUs, we are currently sitting at around 450. So in that red range, if you were just to continue that into mid-January, but we certainly did much better than expected based on these models until the end of December. But that's when we started to see the increase across the province in ICU admissions as well. And I will show you that towards the end of the presentation. Next slide. We do have some data or modeling locally. These is the publicly available ones. There's been an update this week that I'm not allowed to show, but looks relatively similar. So this would be the case burden in the community, which is predicted to peak mid-January. So around now, within the next few days. And that's still holding true. So we expect that we are peaking or have peaked or will be peaking within the next few days. Next slide. Now, what everyone is aware of is that the hospital metrics are lagging behind the case metrics, right? So if you are saying we are peaking this week, as in the slide I showed you previously, that would mean we will be peaking in hospital in a week plus from now. ICU may be as far out as 2 weeks from now. Keeping in mind that the case numbers are also always delayed to some extent based on turnaround times, etc., etc. Not so much in Hamilton, thanks to the great lab resources that we have here. But again, you would see here expected peak within a week or two. What's been shown in the new models, not here so much, is that the number of hospital admissions has been overestimated, and it looks like we are more following the green than the blue or red scenario here. Keeping in mind that this is really patients who are as severely sick in the community that they require treatment for their COVID infection in hospital. So that's what's being modeled here, and only for our catchment within Hamilton, knowing that we have people from outside of the city of Hamilton as well. Next slide. They also try to model ICU hospital admissions here, and you can see that this would peak when you follow the blue, which seems to be, even that seems to be a more pessimistic model than was thought. It would have peaked at around 3, again, 1 to 2 weeks from now. And that's still the assumption. It may be less than what you see here, based on what we've seen over the last couple of weeks in terms of increase. We certainly saw a significant increase in terms of ICU admissions, but not as much as previously expected, and most certainly not as much as in the orange scenario here. Next slide. So bottom line from my presentation today, case numbers are expected to peak either this week or next week latest. That's the city of Hamilton. And as Rob mentioned, we are probably one of those communities that had a much higher Omicron activity early on. So we may be peaking before many other regions within Ontario. Hospital admissions expected to peak, I would say, within the next 2 weeks, based on the best we know at this point of time. And again, it's a crystal ball. It may eventually be wrong, but that's our best assumption at this point of time, or maybe earlier. And that's the silver lining I wanted to finish my presentation with today. The next slide, please. While one day doesn't make a difference in terms of trends. Next slide, please. In trends, for the first time since we saw that significant increase in COVID-related admissions to the ICU starting a couple of weeks ago, we see actually a reduction today. Probably an outlier. I would expect it continues to increase, but at least it could be an indication that this increase of the daily increase, so to say, starts to stop, that we may go into more of a plateau in the next few days. Again, never overestimate a one single data point, but at least it gives us some optimism that things are on the right track and that this wave will obviously not go on forever, and that we are getting closer and closer to that peak. Handing over back to you, Aaron. Thank you.
Thanks very much, Dominic. We did want to keep things relatively tight today, recognizing everybody's schedule. So we did solicit questions for this town hall by email. We received a few, but would just like to remind everyone, if you do have questions arising from today's content, you can send them please to hhsnews@hhsc.ca. We'll endeavor to get a response to you in a timely manner through that email line. There is one question I wanted to pose. I know it's topical both in news media and certainly on social media as well. Maybe Rob, you could respond. It's just, where does HHS sit in relation to our mandatory vaccination policy? With the challenges we are facing, that policy does remain a priority. Can you talk a bit about why that is?
Yeah, I think that with the current variant, the vaccine mandate is as important or more important than it ever has been. It's important to note that after the various rounds of notice that have been given, the number of people left in that category has declined to what is really a tiny fraction of our overall workforce. And of the number that's left, I would say a significant plurality are folks who are not complying with even the most basic provisions of the vaccine policy here at HHS. So I do not intend to deviate from the policy. We will continue forward.
Okay, thanks for that. So we'll close there on questions, but just reminding everyone, you can email in questions arising from today's content, or to suggest topics you'd like to see in our next town hall. That's very helpful to do. But maybe we'll move now to celebrations, which remain an important part of recognizing what's happening across our organization and the intense contribution being made by so many. So to our participants, who I think we'll open the chat line to, as well as our panelists, should you wish to type a chat, we'll read it out for you. Should you wish to raise your hand and make it known, celebrate a colleague, a unit, a team, an accomplishment, then we'd like to hear from you. I see Michelle LaRue, you have your hand up. What would you like to celebrate today?
Thanks, Aaron. Just wanted to kick off a good news story and say that for those of you who haven't heard yet, HHS was named a top employer for Hamilton Niagara for 2022. You can see the news on our website, on the hub. This is really about our employees and our physicians and our learners, about how incredibly hardworking and compassionate they are, how they've persevered through everything for their patients in this community over the past 2 years. So this award is about our people. And just wanted to do a little shout out and say thanks, because it's about all of you and what you've contributed to HHS. And also a little hint that there's more to come next week about another exciting award announcement. So stay tuned.
Great, thanks for highlighting that. So just a call to our panelists or to our participants. Dave McKeag, I see you have a hand up. What would you like to celebrate today?
Thanks, Aaron. Just a shout out to there's an incredible amount of work with a lot of partnership with folks like Lucas and Carrie Lynn and others in terms of having the capabilities to provide both vaccination and swab dedicated resources for our healthcare workers to try to keep ourselves as safe as possible and remain as able as possible to come to work. So EHS and lab pharmacy is a big list. So just a shout out to everyone trying to do the best we can for ourselves.
Good stuff. Thanks very much, Dave. Rob, you're back on camera.
Yeah, I wanted to give a shout out to HR and to Employee Health Services, more particularly. This has been such a challenging time, given the number of staff who've had exposures and have been in self-isolation. I know all of the team in HR has been inundated with phone calls and so on. So just a shout out to all of their hard work and how much they've done to help us get through this very challenging period.
Excellent. Leslie, I see your hand up. I'm just going to read a couple from our chat forum first, and then I'll get to you. So here from Bazolia, I'm not sure, that's probably last name, but thanks for writing it in. The satellite health facility was successful in getting out of an outbreak with a minimal amount of time. So thanks all to the 4th floor and to all the satellite health facility staff. That's great too. From Sarah, picking up on that same topic, bravo to that team for that accomplishment. From Wendy Sidelights, to all those in employee health or deployed to them, trying to clear staff for return to work. Thanks for that effort. Also to Deb Bedini, thank you to the mobile vaccine clinic who are providing vaccines for our patients. From Leslie Gillies, congrats and thank you to the 4E medically complex team at St. Peter's Hospital who recently came out of outbreak this week. Maybe I'll stop there. I'll read a couple more once you've had a chance to give us your celebration, Leslie.
So thanks, Aaron. I just really wanted to thank all of the physician offices, their teams, and the teams in the procedural areas for some really difficult conversations to communicate the postponements of procedural care. They have a really tough message with the talking to families and really appreciate everything they're doing.
Nice. Thank you for mentioning that. From Carissa Corden, shout out to the internationally educated nurse integration program whose pilot work in the fall is now rolled out provincially. Thanks to all the managers, educators, and staff preceptors who volunteered to take on the IEN learners. From Brenda Bachura, extending a huge appreciation to Michelle Cassidy from Health, Safety, and Wellness for all of her ongoing support of our teams here at Juravinski Hospital. Her approach is so warm and genuine, allowing many of the staff to gravitate towards her for support. Thanks, Brenda, for making that shout out. And from Michelle Cassidy, an enormous thanks to our EHS team who are working around the clock. Now, from my colleague, Kaylin Pettit, we're usually behind the scenes, but I'd like to extend my gratitude to the entire communications and public affairs team who's working hour by hour, including after hours, to keep our workforce and community apprised of the wide range of ever-changing information, including via this very town hall. So thanks, team. Thanks, Kaylin, for recognizing the team. Let me see here, Dr. Natasha Johnson, those who wrapped gifts to raise money for the Master Children's Hospital Foundation. Shout out to that team. Thank you for that. From Deb Bedini again, thank you to Biku Tajura, HGH, our Hamilton General Hospital outpatient pharmacy manager, who gave vaccines to our staff and patients at Hamilton General Hospital. It was very much appreciated by everyone. From Susan Pucciarelli, thanks, Rob, for the shout out to EHS. So that's great stuff. And from Kirsten Kroll, we're so grateful to the infection prevention and control team who have provided exceptional guidance in the surveillance and management of a very sneaky virus. So true. Bruce Squires, to everyone in the infection prevention and control teams for their tireless work in supporting patients and our teams through outbreaks and infection control. Oh, There you go. From Bazolia is Amelia Bazo. Sorry, I've changed it. Okay, Amelia, thanks for leading the shout outs today and for correcting that. Also from Heldmont, maybe I'll get a name correction there too. Shout out to microbiology, LRC, and HRLMP for all their work. From Antonella Sequina, shout out to HRLMP as well, who've been processing all the COVID testing and getting them out to providers. I'm going to keep going. We just have an outpouring of celebrations today from Colleen Patey. A big thanks to the patient experience coordinators who fielded multiple calls from patients and families to address their questions and concerns through all of these COVID changes. From Roseanne Zimmerman, kudos to the infection control team who provided so much support to the many clinical teams working through the outbreak management. I so appreciate their tireless efforts to support all of our teams. From Wendy Criciola, shout out to all the core lab staff for all the extra hours and dedication, registering the thousands and thousands of COVID swabs, a huge team effort and a dedicated team. From Leslie Gauthier as well, Deb, the outpatient managers, Jason Thomas. Dan Trottier, much appreciation to the frontline care workers, but also to the background support staff supporting those frontline staff. From Leslie Gillies, thanks to all the frontline staff and leaders and physicians for their incredible work under challenging circumstances. From Mike Mans to everyone, thank you for staying the course on the mandatory vaccine mandate. From Elena Potts, thank you to all the redeployed staff who are providing such much needed support to the many teams. From Jackie Conry, thank you to all the frontline staff that continue to provide exceptional care in challenging times. From Caroline Crapples, thank you to all the managers who are going above and beyond this to support their staff and provide guidance and direction. From Leslie Gauthier, thanks to Gwen Liu and Allison Petrella for their leadership on the mobile vaccine teams and all the site work. From Kelly O'Halloran, thank you to all the nurses and healthcare aides at Satellite Health Facility and throughout HHS who are working short most shifts. We really appreciate your ongoing dedication to our patients, families, and teams. Thank you, Nate, Carissa, and the team for helping us support those teams with recent redeployment of staff. It makes a difference. And thank you to all the redeployed staff for jumping in too. From the Medical Staff Association, thank you to all the physicians across all of HHS sites and the Hamilton community. We will be celebrating virtually many of these physicians at the MSA General Business Meeting, which is on January the 20th. From Isabel Hayward, thanks to the frontline staff. You are the answer. Thanks to Critical for also being the ongoing beacon of help in this journey. From Andrea Frolick, grateful to all the frontline managers and clinical leaders who are so creative in finding solutions to staffing challenges and for rallying their people with hope and camaraderie to keep on providing the best care we can. Am I getting close to the end? I feel like this is mounting into a challenge, but I'm so close. I'm going to keep going and finish. To our human rights, from Michelle LaRue, our human rights and inclusion team, who do so much behind the scenes with many key initiatives. From Dave McKeag, similar to Kalen's comment, huge thanks to the collaboration with HR, including EHS, finance, planning, analysis, decision support, providing behind the scenes incredible support and information to our leaders. From Heidi Tichler, thank you to all the social workers that are providing endless support to our patients and staff during this difficult time. Dave's provided a link here. I don't have time to click it, but you should. Julie Chase would like to say to the radiation department at the Juravinsky Cancer Center, who pick up each other every day to ensure our patients get the very best care every day. From Sarah, we have thanks to Renee Matrandolo for welcoming and onboarding all the new credentialed trainers with exciting new opportunities. From Yasmin Ramos Revis, thank you to all the team leads, charge nurses on the front line. From Marta to Andrea and Kristen for being the type of leaders who promote, encourage, and support on the ground staff resiliency support. And again, from Natasha Johnson, Dr. Johnson would like to give thanks to all the business clerks and admin assistants keeping everyone afloat. And Callie O'Halloran, thank you to the executive team for working long hours to support the teams that provide care to our patients. Well, that was a very epic marathon of celebrations today. Really nice to see. What a wonderful way to conclude the first town hall of 2022. Well, maybe only thing that would make it better, Rob, is maybe some closing remarks from our CEO. So over to you for that. And thanks to everybody for your participation.
Yeah, I think I should do a shout out to Aaron for doing such yeoman's work and getting through all of that gratitude, which I agree was very touching. So thanks everybody for your time today. We'll do our very best to continue to keep you apprised as we move forward through these very challenging times. In between these town halls, please stay tuned to the regular communications channels, including the Hub and the Hub app. And your leader, of course, is also an excellent source of information and is here to support you. So until next time, and being mindful of the words that Andrea shared with us, please do your best to take care of yourselves. We absolutely need you to take care of yourselves in the best possible way so that you can continue to take care of our patients. So thanks for all of your contributions. I can't tell you how grateful we all are for what you're doing. You're making such a big difference for our community. So thank you. Have a great rest of the day. Thanks, everybody.